Hello and good evening, everyone. How are you guys doing? Yes, I hope all of you are fine and doing well. So, welcome to another live session on Idento. Now, today's live session is exclusively for our NEET MDS aspirants. All right. Yes. We had already completed learning microbiology for our NEET MDS 25-26 batch. And so in today's session, I'll be discussing some of the very important and high yield MCQs from microbiology. All right. Yes. So microbiology, together with general pathology, you can expect an average of 14 questions for your NEET MDS examination. From microbiology alone, you can expect somewhere around like 5 to 7 questions. And since microbiology is like a basic laboratory-based subject, more questions can be like from direct, straightforward questions, but you can expect lots of like clinical based and application based questions also. All right. Because if you look at the recent NEET MDS examinations, lots of clinical based and application based questions were asked, even from basic subjects like physiology, anatomy, microbiology, like that. Okay. So definitely you can expect lots of clinical based and application based questions from microbiology also. All right. Yes. So in today's session, I'll be mainly focusing on such clinical based or application based questions and also some of the statement based questions. Okay, the ones that you see for like INICT exams and all. Yes, let's have a look at that. Okay, so first question, choose the anaerobic culture media among the following. Is it alkaline? So the media that are given in the options are like alkaline peptone water, thioglycolate medium, Robertson's cooked meat medium, and selenite F broth. Okay, so among these, which are all anaerobic culture media? Is it peptone water and thioglycolate medium, or thioglycolate medium and Robertson's cooked meat medium, or alkaline peptone water, thioglycolate medium, or and Robertson's cooked meat medium, or all of the four? All four anaerobic culture media. What do you think? Yes. So let's have a look at the classification of bacteria. Okay, let's start from the basics. Classification of bacteria. All right. So bacteria can be classified in various methods based upon its size, shape, and its staining characteristics, like in how it reacts in gram stain and how it reacts in acid fast staining, like that and all. There are so many classifications by which you can uh, classifications for bacteria, but one such important classification of bacteria is based upon its oxygen requirement and metabolism. All right. So based upon the oxygen requirement and type of metabolism that is happening inside the bacteria, it can be majorly classified into three types. One is aerobic bacteria, second one is anaerobic bacteria, and the third one is microaerophilic bacteria. All right. So aerobic bacteria are those bacteria which needs oxygen. Okay, as simple as that. They need oxygen. Okay, they are called as aerobic bacteria. Then the ones that do not need oxygen, they are called as anaerobic bacteria. Okay, then there's a third type that is called as the microaerophilic bacteria. Okay, so what are these microaerophilic bacteria means? They require only low levels of oxygen. Okay, less than the atmospheric concentration. Yes, they require only such low levels of oxygen. Okay, high levels are harmful for them. Okay, so that's what's meant by microaerophilic bacteria. All right. Now, this aerobic bacteria and anaerobic bacteria can again be subclassified into obligate aerobes, and there are facultative anaerobes, and there are obligate anaerobes and aerotolerant anaerobes. Okay. So, what are obligate aerobes? Obligate aerobes means they are strict, like what to say? They definitely need oxygen. Okay, they require oxygen for their growth. Okay, so they strictly need oxygen for their growth. Okay, they are called as obligate aerobes. Without oxygen, these organisms will die. Okay, so such organisms are called as obligate aerobes. And the typical examples of obligate aerobes include Vibrio cholerae and Mycobacterium tuberculosis. All right. Then we have another group that is called as facultative anaerobes. Facultative anaerobes means they can grow with or without oxygen. Okay. Usually for their metabolism, they prefer oxygen. But if oxygen is not available, then they can grow without oxygen also. Okay. They are adjusting type. Okay. So such type of bacteria are called as facultative anaerobes. Okay. And the classical example is E. coli. All right. Then we have obligate anaerobes. Obligate anaerobes, just like the obligate aerobes, just the opposite of that. Okay. They strictly do not need oxygen. Okay. If oxygen is present, then these oxygen is like toxic to them. Okay. Oxygen is like a poison to them. Okay. They perish in the presence of oxygen. Okay. So such organisms are called as obligate anaerobes. Okay, and the example is Clostridia. All right, they are strict anaerobes. Okay, they do not need oxygen for their metabolic functions. Okay, they are good without oxygen. Okay, and for these obligate anaerobes, this oxygen is like toxic, or oxygen is like poison for them. Okay, then there is another category that is called as aerotolerant anaerobes. Okay, aerotolerant anaerobes means they are like the anaerobes. They also don't require the oxygen, but they are not like they don't feel like oxygen is like poison to them. Okay, they can tolerate oxygen. Okay, they will not perish in the presence of oxygen, but they do not require oxygen. Okay, so compared to obligate anaerobes, which acts like oxygen is poison to them, these aerotolerant anaerobes, they can tolerate oxygen. It's not like a poison, it's not like toxic to them, but yes, all their metabolic functions, they take place without the presence of oxygen. Okay, so such organisms include Streptococcus pyogenes and Clostridium histolyticum. Okay. Then the microaerophilic organisms, that is the one which require low levels of oxygen. Okay. High oxygen levels are harmful for them, so they just require low levels of oxygen. And the example of such microphilic bacteria includes Helicobacter pylori. Okay. Now, for culture, okay, culturing means for growing the bacteria in a lab. Okay, to study its characteristics, to study how it behaves, to study how it multiplies and all, we can grow the bacteria inside the lab. Okay, this culturing of aerobic bacteria is comparatively easy. Okay, but anaerobic bacteria, it is somewhat difficult to culture them. Okay, why difficult? Because the environment in which this anaerobic bacteria is growing, okay, that should be completely devoid of any oxygen. Okay, so for completely removing oxygen, we should take some measures. Okay, so what all can be done for this anaerobic culture methods? If you look at it, there are like 5 anaerobic culture methods that are usually done. One is Macintosh and Fielday's anaerobic jar can be used. The next is gas pack. Then the third one is pre-reduced anaerobic system or the PRAS. And fourth one is anaerobic chamber or the glove box, which is like this. And the fifth one is the anaerobic culture medium. Okay, so this Macintosh and Fielday's anaerobic jar, it is a reliable method and it is widely used. It contains a glass or metal jar like this. Okay, and that jar will have an inlet and will also have an outlet. Okay, and it is connected to the electric supply also. Okay, so first what they do is that they will after placing all the culture plates inside this anaerobic jar, what they do is that they will remove all the air within this anaerobic jar. Okay, and then they will supply it with hydrogen gas. Okay, and then electric current is passed in. Okay, so that this whole anaerobic environment is developed inside this Macintosh and Field's anaerobic jar, and these microorganisms, these anaerobic microorganisms, they will grow in these culture plates that are kept inside this jar. All right, so that's about Macintosh and Field's anaerobic jar. Now there is something called as gas pack system also. Gas pack system means it is more like a disposable envelope. Okay, in the envelope you will have like chemicals present. Okay, you just have to take this envelope and just mix it with water. Okay, when you mix it with water, it will generate hydrogen and oxygen. Okay, and it will create like an anaerobic environment also. Okay, so what you have to do for this gas pack system is, again, take a jar like this, the similar one, take a jar like this, okay, and put the culture plates inside and put the gas pack system also inside. Okay, so just open the gas pack system and add water. It will start releasing hydrogen and oxygen and create a anaerobic environment inside that particular jar. Okay, so that will allow the growth of anaerobic bacteria. All right, so that's about gas pack system. Then there is something called as pre-reduced anaerobic system or PROS. Okay, pre-reduced anaerobic system means already we are getting like already prepared media. Okay, it's like culturing in the culture media, but the culture media is already ready. We don't have to like prepare it with individual ingredients. Okay, it's already ready made. Okay, so that's called as pre-reduced anaerobic system. And then we have anaerobic chamber or glove box like this. Okay, so this is the anaerobic chamber or glove box. It is like an airtight glass fronted cabinet with that is supplied with lots of inert gas. Okay, inert gas means they are like chemically non-reactive and stable, and the gas which does not undergo chemical reactions readily. Okay, so such gas is supplied inside this chamber. Okay, like helium gas or neon gas, such inert gas is supplied inside this chamber, and we can like put the culture plates inside and move it inside with the help of these glove shaped hands that are present in the chamber. Okay, then at the last we have this anaerobic culture media. Okay, anaerobic culture media means in the culture plates you can make this culture media and help it, which will help in the growth of this anaerobic bacteria. Okay, for a bacteria, this culture media is just like how the soil is for the plant. Okay, so just like how the soil contributes all the nutrients and gives the all the required things that are needed for the growth of the plant, just like that only the culture media is for the bacteria. Okay, it gives all its nutrition and everything to the bacteria so that it will grow. Okay, so choosing this culture media is extremely important. For every bacteria there is like a special culture media in which it will grow in huge amounts. Okay, so try to know what that culture media is. So for anaerobic microorganisms, we usually use this anaerobic culture media, and there are three common anaerobic culture media. One is Robertson's cooked meat medium. Second one is thioglycolate medium, and the third one is Smith-Nogoshi medium. All right. So these are the three anaerobic culture media. Now, Robertson's cooked medium, it is something like this. Okay. It is the most widely used anaerobic culture media, and it can be used as a transport media also. How it is prepared? It is prepared by using fat-free minced meat. Okay. Just like the name suggests, it is made by a fat-free minced cooked meat. Okay, cooked meat and in a broth. Okay, and when the organisms start growing, there will be color change. Like it can change its color to pink or red or black, like that. All right, based upon the organism which is growing inside it. Okay, And the second most important anaerobic culture media is this thioglycolate medium. Okay, so this thioglycolate medium, it contains like thioglycolic acid, yeast extract, and lots of calcetone, sodium chloride, like that. Lots of ingredients are involved in it. Okay, because of this presence of thioglycolic acid and all the other components, what happens is that for this thioglycolate medium, the oxygen concentration will be highest at the top and lowest at the bottom. Okay, because of the presence of the ingredients that are specially seen in the thioglycolate medium, the oxygen concentration will be highest at the top and lowest at the bottom. Okay, so in this thioglycolate medium, not just anaerobes, but you can grow aerobes and other facultative anaerobes and aerotolerant anaerobes also. Okay, so how will we identify which organism is growing? Okay, that's based upon the position in which these organisms are growing. Okay, so if this is the four four tubes with the thioglycolate medium, if you are growing the obligate aerobes. Okay, so these obligate aerobes will usually grow at the top only. Okay, why at the top? Because I had told you already, the oxygen concentration is high at the top. Okay, and it is low at the bottom. Okay, since these are obligate aerobes, they need oxygen to thrive. Okay, so they grow at the top portion only. Okay, if it's the obligate anaerobes, then they grow at the bottom portion only. All right, then there are facultative anaerobes also. They grow throughout, but yes, usually maximum seen at the top portion only. All right, then there are aerotolerant ones also. Aerotolerant anaerobes, they are like evenly seen throughout the media. Okay, so based upon the position in which the colonies are growing, we can predict from this thioglycolate medium whether they are obligate aerobes or whether they are obligate anaerobes or whether they are facultative anaerobes or whether they are aerotolerant anaerobes. All right. Then the third one is the Smith-Noguchi medium, which is a medium that is prepared with fresh animal extracts. Okay, the spleen, kidney, and the liver of the animals are taken, and the mm, medium is prepared. It is mainly for cultivation of spirochetes like the Treponema pallida. All right. Yes. Next question. Find out the correct statement or statements regarding sterilization control. Okay. Sterilization is another favorite topic of examiners. Alternatively, I think there were questions on sterilization being asked. Okay, so the spores of Bacillus stearothermophilus is used as biological indicator of plasma sterilization, or Bacillus stearothermophilus spores are used as biological indicator for autoclave, or Bacillus atrophius is used as a biological indicator of ionizing radiation, or Bacillus atrophius is used as a biological indicator of ethylene oxide sterilization. Okay, so which of the following statements are true or correct? All right. So for that, first let's have a look at what this sterilization control is. Okay, so what do you mean by sterilization control? Okay, sterilization control means, to put it in simple words, is just checking and confirming whether the sterilizer that you are using is actually working. Okay, working means whether that sterilizer is killing all the microorganisms. Okay, so that's called as sterilization control. Okay, you are just checking whether the type of sterilization, any type of sterilizer that you use is working properly and whether it is killing all microorganisms and spores. Okay, so that's what the sterilization control means. Now, there are three methods for the sterilization control. We can do physical check, or chemical, or biological. Okay, physical methods include checking whether the spores or they checking whether the sterilization has happened by physical means. Like you can use thermocouples or temperature gauge or pressure gauge can be used as physical methods. Then there is chemical methods also. So chemical methods, you will be using like indicator strips or Brown's tube and placing it inside along with the instruments. And if there is a color change that is happening, then you can confirm that, okay, the sterilization is complete and all the spores had died. Okay, that's the chemical method. Then there is the third one, that is the biological method, which is the most reliable method. And how in biological method, what we are doing is that along with the instrument, we place some spores. Okay, spores of some particular bacteria only. Okay, we are placing the spores of some particular bacteria in the sterilizer, and we are checking, okay, whether the spores are getting killed or whether the spores are getting survived. Okay, if the spores are getting killed, then that means that sterilization is successful. All right. If the spores are surviving, then that means that the sterilization has failed. Okay. So this is the biological method of sterilization control. Okay. So what all bacteria are usually used for this biological method of sterilization control is, for plasma sterilization, we usually use Bacillus stereothermophilus, which is also called as Geobacillus stereothermophilus. Why this bacteria? Because it can withstand like high temperatures. Okay, so that's why we are particularly using this bacteria. All right. Then for autoclave, also we can use the same Bacillus stereothermophilus. For ionizing radiation, we usually use Bacillus pumilus. Okay, because this Bacillus pumilus spores has the capability to withstand high amounts of ionizing radiation. Okay, so that's why we are using this pumilus subtype. All right. Then the fourth one is ethylene oxide sterilization, which is done with the help of Bacillus atrophius. Okay. So these are the four bacilli that are commonly used for biological sterilization control. Okay. So let's have a look at the different sterilization method and the biological indicator organism. For autoclave, steam sterilization, for hydrogen or the plasma sterilization, and for the chemical sterilization methods, we can use Bacillus stereothermophilus. All right. For dry heat and for ethylene oxide type of sterilization, we can use Bacillus atrophius. Okay. For radiation, mainly for ionizing radiation, it is best to use Bacillus pumilus. All right. Yes. That's about the different sterilization methods and the biological indicator. So these are the statements that were given in the option. Bacillus that were given in the question. So the Bacillus stereothermophilus, yes, for plasma sterilization, it's true. Bacillus stereothermophilus for autoclave, that is also a true statement. But Bacillus atrophius for ionizing radiation, that's a false statement because usually we use Bacillus pumilus only. All right. Bacillus atrophius is mainly used for ethylene oxide type of sterilization and for dry heat. All right. Okay, this table is also important. Now, next question. A 6-year-old child develops rapid onset of urticaria, lip swelling, wheezing, and difficulty breathing within minutes after consuming peanuts. Which type of hypersensitivity reaction does this represent? Okay. So, 6-year-old child consumed peanuts, and immediately there was like a rapid onset of like urticaria, lip swelling, wheezing, difficulty breathing. All those symptoms were there. Okay, so this is a typical case of food allergy. Okay, so food allergy is which type of hypersensitivity reaction? So for knowing that, first we need to see what this hypersensitivity reaction means. Okay. So what do you mean by hypersensitivity reaction? There are like lots of immune reactions happening in our body. Okay, immune reactions are the ones that are being performed to protect our body. Okay, but when these immune reactions, when they starts injuring the host body, okay, then such type of reactions are called as hypersensitivity reactions. Okay, the injurious type of immune reactions that happen inside our body that are called as hypersensitivity reactions. Okay, so there are these hypersensitivity reactions can be classified broadly into two types. There is like immediate hypersensitivity reaction and delayed hypersensitivity reaction. Immediate ones include the type 1, type 2, and type 3, and the delayed is the fourth type, that is the cell-mediated type of delayed hypersensitivity reaction. Okay, so this immediate ones, that is this type 1, type 2, and type 3 are mediated by the B cells, that is mainly mediated by the antibodies, whereas this type 4 alone is mediated by the T cell. All right, this is just the basics about hypersensitivity reaction. Now, next we'll have a look at this type 1 hypersensitivity reaction in detail. Okay, so this type 1 hypersensitivity reaction, it can manifest in two forms, can be either acute or fatal or systemic in nature, which is called as the anaphylaxis, or it can be chronic, recurrent, non-fatal or localized in nature, which is called as atopy. Okay, so this if you look at the clinical syndromes or the clinical manifestations of this type 1 hypersensitivity reaction, you can see like anaphylaxis. That may be like drug allergy or bee sting allergy, or the food allergies are all examples of this type 1 hypersensitivity reaction. Then bronchial asthma, allergic rhinitis, sinusitis, and hay fever, they are also examples of this type 1 hypersensitivity reaction only. Okay, so all the allergies, all the anaphylactic reactions and all the allergies, they all come under this type 1 hypersensitivity reaction. Okay, so what is actually happening in this type 1 hypersensitivity reaction is that if the mucosa is exposed to the allergen, okay, any kind of allergen, okay, this allergen can enter our body through inhalation or through ingestion or through injection. Okay, so it can like enter our body through any route. Okay, so first when this allergen enters the body, first it will be recognized by the dendritic cell. Okay, dendritic cells like Langerhans cells. Okay, they are the antigen presenting cells. Okay, so they will just take this allergen and will present it into the T cells. Okay, so it will go into the T cells and the T cells will get activated, especially the helper T cells. Okay, the helper T cells will get activated and it will release lots of cytokines. Okay, what all cytokines it releases? One is interleukin 4, second one is interleukin 5, and the third one is interleukin 13. Okay, 4, 5, and 13 are released. Okay, interleukin 4 will stimulate all the B cells. Interleukin 5 will activate all the eosinophils, and interleukin 13 will act on the epithelial cells and will increase the mucus production. Okay, so this is the function of three interleukins. Okay, 4, 5, and 13. 4 B cells, 5 eosinophils, and 13 mucus secretion. Okay, now yes, lots of eosinophils and B cells, they will be coming into the site. And yes, plasma cells will also be coming, which will be secreting like IgE. Okay, IgE secreting plasma cells will come into action, and mast cells also come. Okay, so these mast cells will go and readily bind with the Fc portion of this IgE. Okay, they will go and readily bind with this Fc portion of IgE. And if there is like repeated exposure of the same allergen. Okay, if there is like repeated exposure of the same allergen, then what happens is this already sensitized mast cells are there, right? The ones that had attached to the IgE antibodies, these mast cells will get activated. Okay, so when these mast cells, when they get activated, it will release lots of mediators. Okay, what type of mediators it can release? It can release vasoactive amines like the histamines, or the lipid mediators like the prostaglandin and the leukotrienes, or it can release lots of cytokines also. Okay, so these histamines and the leukotrienes and the prostaglandins, they are the ones that help in this immediate hypersensitivity reaction. Okay, just minutes after getting exposure to the allergen, that it will be like lip swelling, difficulty in breathing. All those are like typical features that are produced by these vasoactive amines and lipid mediators only. Okay, the late phase reaction, that is like after 2 to 24 hours, after like repeated exposure to allergen and all, that is mainly produced by this cytokines. Okay, so the histamines, it can cause like vasodilatation, smooth muscle contraction, increased vascular permeability, and increased secretion of mucus. Yes, that's all by histamine. Prostaglandin and the leukotrienes, they are the ones which cause intense bronchospasm. Okay, they are the ones which cause intense bronchospasm, and it also helps in the increased mucus secretion. All right. Now let's have a look at the summary of all these type of hypersensitivity reaction. Type 1, we had already discussed all the anaphylaxis, allergies, bronchial asthma, atopic forms, okay, atopic dermatitis. Okay, all those forms are like typical examples of type 1 hypersensitivity reaction. Within minutes, it will be manifested. Mainly, the IgE and histamines are involved in it. Okay, the mechanism we had already discussed in detail. Then autoimmune hemolytic anemia and Wood-Pasteur syndrome. Okay, they are all examples of type 2 hypersensitivity reaction. The time for manifestation is variable. Okay, it may manifest within hours or it may take some days. Okay, it is usually mediated by the immunoglobulins like GM and the complement pathway also. All right, type 3 SLE and glomerulonephritis, serum sickness, and Arthur's reaction are all examples of type 3, which is mediated by, again, immunoglobulins like GM and complements and the leukocytes. And the type 4, the typical examples are contact dermatitis, multiple sclerosis, type 1 diabetes, and the tuberculin-like reactions. Okay, this is mainly mediated by T cells. Okay, T cells, the lymphokines, and the macrophages, the cells. The T cells are the ones which mediate this type 4 or the delay type of hypersensitivity reaction. All right. Yes, moving on to the next question. A group of people presented to emergency department with complaints of vomiting, diarrhea after consumption of food at a marriage reception. The causative agent for food poisoning with incubation period of 1 to 6 hours is, okay, is it Staphylococcus aureus or Clostridium perfringens or norovirus or Vibrio parahemolyticus? All right. Yes, all the four pathogens that are given in these options are capable of producing food poisoning. Okay, but the one which has the shortest incubation period that is the incubation period of 1 to 6 hours, is Staphylococcus aureus. Okay, so yes, like I had told, all are capable of producing food poisoning, but the one with the shortest incubation period, okay, that is just 1 to 6 hours. Okay, within consuming the infected food, within like 1 to 6 hours, there will be like vomiting, diarrhea, and all will be present. Okay, so that's a typical example of Staphylococcus infection. Okay, how Staphylococcus is capable of producing this food poisoning? Which toxin is responsible? It is the enterotoxin. Okay, so enterotoxin is what is responsible for causing this food poisoning. Okay, so Staphylococcus aureus, as you all know, it is a gram-positive cocci. It is non-motile, it is non-sporing, and in the gram staining, it will form grape-like clusters like this. Okay, just like this. Grape-like clusters like this will be formed in the gram stain picture. Okay. And if you look at the culture media, okay, in the nutrient agar or in the McConkey agar, in the nutrient agar, it will usually show yellow colonies like this. Okay, it is actually described as golden yellow colonies. Okay, in the McConkey agar, it can produce pink colonies. Okay, it is both coagulase positive and catalase positive also. Okay, so what all infections the staphylococcus can produce in our human body can affect any system. Okay, can affect the skin and the soft tissues, can affect the musculoskeletal system, the respiratory system, CNS, endovascular system, urinary system, and like that, almost all the systems can be affected uh, with the staphylococcus. All the typical skin lesions like the folliculitis, furuncle, abscess, wound infections, carbuncle, impetigo, like this are all characteristic features of this staphylococcus infections. Okay. Then musculoskeletal disorders like the osteomyelitis, arthritis, myositis can be caused by the staphylococcus species also. And the respiratory ones. Okay. Along with the streptococcus, this pharyngitis, tonsillitis, sinusitis can be caused by staphylococcus, and meningitis, bacteremia, endocarditis, and urinary tract infections. Okay, mainly the saprophyticus subspecies can cause this urinary tract infections. All can be the diseases caused by this staphylococcus. Okay, then there is another a, a category that is called as the toxin mediated diseases. Toxin mediated diseases means the staphylococcus species, they will release lots of toxins. Okay, these toxins will go and bind with the particular cells and will create diseases. Okay, so this toxin mediated disease includes food poisoning, toxic shock syndrome, and the scalded skin syndrome. Okay, so these three diseases are the ones which are caused by the staphylococcal toxins. Okay, so let's see what are all the toxins that are formed by this staphylococcus. There are four types or four categories of toxins that are usually released. The first one is cytolytic toxins. Okay, the most common one is the cytolytic toxin. It is again divided into the cytolytic toxins include hemolysins and leucocidin. Okay, so this hemolysins can again be of like four types: alpha, beta, gamma, and delta. And we have a leucocidin that is called as the Pantone Valentine leucocidin. Okay, so this alpha hemolysin is the major one, which is responsible for all the hemolytic functions and for the can affect the macrophages, lysosomes, muscle tissues, renal cortex, and circulatory system and all. All right, the major one that is responsible for causing all the disease manifestations. It is alpha hemolysin. Okay, then this Pantone Valentine leucocidin is also important. Why important? Because it is the one that is most commonly seen in community associated methicillin resistant Staphylococcus aureus. Okay, so in MRSA, these type of leucocidins are usually seen. So that's why it's more important. Then we have the enterotoxins and toxic shock syndrome toxin, which is causing the toxic shock syndrome, and exfoliative or epidermolytic toxin, which is responsible for the staphylococcal skin scarlet syndrome. Okay, so what are these enterotoxins? They are heat stable toxins. Okay, so at normal cooking temperatures, these type of toxins can thrive. Okay, the bacteria may die, but the toxins can survive. Okay, the toxins will thrive. Okay, at the normal cooking temperature, this type of toxins can thrive. Okay, so that's why it is a common pathogen for food poisoning. Okay, so some types even can withstand like 121 degrees Celsius and all. Okay, commonly seen in meat, fish, milk, and milk products. There are like 8 antigenic types of this enterotoxins, ABC and DEH. Okay, this type A is the one that is most commonly responsible for this food poisoning. And the characteristic feature of this toxin is that it will go and directly act on the autonomic nervous system instead of going and acting on the gastrointestinal mucosa. Okay, so that is one particular characteristic feature of this toxin. And this is the one that is responsible for post antibiotic diarrhea also. All right, it can exhibit pyrogenic, okay, fever, like, and mitogenic, hypotensive, thrombocytopenic, and cytotoxic effects also. Okay, so that's about the enterotoxins and the staphylococcus. Now, which of the following statement is true regarding Streptococcus agalactiae? Okay, this Streptococcus agalactiae, it belongs under the group B Streptococcus. Okay, so which of the following statement is true? Is it commonly transmitted by foodborne routes? Or does it cause neonatal meningitis due to LLO toxin? Or the CAMP test is positive when plated with Staphylococcus aureus? Or it is sensitive to bacitracin and octokin? Okay, so yes, for that, first let's uh, do a little bit, learn about streptococcus. Okay, so what are streptococci? Streptos means twisted or coiled. Okay, cocci means the ones that are in round shape. Okay, so these are gram-positive cocci that are present in chains or pairs. Okay, so under the gram stain, it will look like this. Okay, just like this blue beaded necklace. Okay, just like this only, it will look under the gram stain. Okay. Now, these streptococci, there are like classifications of the streptococci. The first one and the major one was given by Brown et al. In 1990. He cultured this streptococci in 5% host blood agar and observed how each species is reacting. Okay. So based on that, he had divided the streptococcus species into, there is something called as alpha hemolytic streptococci. Okay, so this alpha hemolytic streptococci will produce alpha hemolysis like this. Okay, like this greenish discoloration. Okay, why this greenish discoloration? Because only partial hemolysis is happening here. Okay, so that's why it's producing greenish discoloration. Okay, so the species like the viridans and the pneumonia, they usually show this alpha hemolysis. Okay, so they are called as this alpha hemolytic streptococci. All right, then we have like the complete hemolysis can happen. Okay, so this complete hemolysis will produce a colorless uh, hemolysis like this. Okay, so this type of hemolysis is usually seen in beta hemolytic type of streptococci, which mainly includes the pyogenes and agalactiae. Okay. Then at the last is gamma hemolytic streptococci, where no hemolysis is taking place. Okay, no hemolysis at all. Okay, so it will appear red in color. Red, that is the color of the blood agar. Okay, it will appear just like that. Okay, so Enterococcus faecalis is an example of this gamma hemolytic streptococci. Okay, then based upon the carbohydrate antigen that is present on the cell wall of these streptococci, again, there is another classification that was given by Lansfield in the year 1933. Okay, so Lansfield had grouped the streptococci into 20 groups. Okay, 20 groups from A to V. Okay, but there is no I and J. Okay, excluding I and J, all the alphabets are there, and from A till V. Okay, so that's called as Lansfield grouping. Okay, then for the group A, Lansfield group A alone, there is like a further subclassification of the Streptococcus pyogenes, which is called as the Griffith typing. All right, so this Lansfield group B is the Streptococcus agalactiae. Okay, so this Streptococcus agalactiae usually shows beta hemolysis, and this type of streptococci are usually seen in the female genital tract and in the rectum. And the main disease that is caused by this agalactiae is neonatal meningitis and septicemia. Okay, so the major disease that is caused by this group B streptococci is neonatal meningitis, neonatal sepsis, postpartum infections, endocarditis, and cellulitis. Okay, so these are the major diseases caused by the group B streptococci, especially the Streptococcus agalactiae. Okay, now how can you identify this Streptococcus agalactiae? Okay, what is the main difference from that of the Streptococcus pyogenes? Okay, which is the most common species that is present in the uh, streptococcus. Okay, so one is beta hemolysis. Okay, that is one feature. You will be able to see hemolysis like this. Okay, colorless, complete hemolysis will be happening. Okay, so this is one characteristic feature of group B streptococci, that is Streptococcus agalactiae. The next one is hydrolyzed hippurate. Okay, the hippurate test will be positive. Okay, so there, if there is like sodium hippurate present, this will release an enzyme which will bind with it and will release its products like glycine and benzoic acid will be released. Okay, so that is called as the hippurate positive test, and also CAMP test will be positive. Okay, so what do you mean by this CAMP test? CAMP test means it is the Christie Atkins Munch Peterson test. Okay, so that's called as CAMP test. Okay, so how do you perform this CAMP test? Take Staphylococcus aureus. Okay, take a Staphylococcus aureus and make a streak in the culture media. Okay, make a streak in the culture media. Then take a group B Streptococcus species like Streptococcus agalactiae and make a streak that is perpendicular to this Staphylococcus aureus. Okay, and observe it after some time. What you will be able to see is that hemolysis. Okay, so this enhanced area of hemolysis. Okay, so this is typically like the arrowhead hemolysis. Okay, so this arrowhead hemolysis, it confirms that, okay, the species that is present here is Streptococcus agalactiae. Okay, so this is called as the CAMP test. Staphylococcus aureus and Streptococcus agalactiae, or any group B streptococci. Okay, it will result in an enhanced area of hemolysis, which is usually called as the arrowhead shaped hemolysis. Okay, so if you will be able to see this arrowhead type of hemolysis, then that shows that CAMP test is positive. If no arrowhead hemolysis, then that means that CAMP test is negative. All right. Then there is something called as reverse CAMP test also. Okay, should not get confused between the two. There is CAMP test and there is reverse CAMP test also. Okay, so what do you mean by this reverse CAMP test? Means instead of Staphylococcus aureus, here we are using Clostridium. Okay, mainly the Clostridium perfringens like that. Okay, some Clostridium species is used. Okay, so first you can make a streak with that of the Streptococcus agalactiae, and then perpendicular towards it, make a streak of this Clostridium species. Okay, if bow tie like hemolysis like this is present. Okay, so this is the bow tie like hemolysis. Okay, if that is present, then it's confirmed that, okay, the species is Clostridium perfringens. Okay, so this is the difference between CAMP test and reverse CAMP test. CAMP test, Staphylococcus aureus and the group B streptococci. Reverse CAMP test, Streptococcus agalactiae, that is the group B streptococci and Clostridium species. All right. So this, if you look at the statements, this group B streptococci, it is transmitted by foodborne routes? No. It is usually present in the female genital tract and in the rectum area. So usually through the delivery only, through like transmitted usually perinatally only. Okay. through the birth canal or via the genital or GI tract only. Okay, not the food. Okay, genital tract only, not the food. Okay. Then it causes neonatal meningitis due to allotoxin. Okay, the first part of this statement is correct. It causes neonatal meningitis. That is right. But is it due to allotoxin? So what is this allotoxin? Allotoxin means the listeriolysin O. Okay, allotoxin means listeriolysin O. Okay, so this is a toxin that is produced by Listeria monocytogenes. Okay, it is not produced by Streptococcus agalactiae. It is produced by Listeria monocytogenes. Okay, so the first part of this statement is right. Yes, it causes neonatal meningitis, but it is not due to allotoxin. Okay, so that's false. Again, next is CAM test is positive when plated with Staphylococcus aureus. Yes, that's a true statement. It is sensitive to bacitracin and uptake. Okay, it is actually resistant to bacitracin and uptake. All right. So out of all the statements that are given, only option C is the correct one. All right. Yes. Next question. Viruses are cultured in which media you can culture virus. Okay. Bacteria are easier. Bacteria and fungi are easier to culture in medium, but viruses are not like that. Okay. It needs its own special environment for its growth. Okay. So this Sabora's agar, that is the Sabora dextrose agar, that is used for the culturing of fungal species. Okay. Rogosa medium, it is the selective medium for lactobacillus. Okay, so both these are ruled out. Now, among this non-embryonated egg and embryonated egg, which one is the correct answer? Okay, non-embryonated egg, there is no embryo present. Since there is no embryo present, there will be no functional membranes like the allantoic membrane, and all those will not be present. And there will be no active metabolism that is happening inside that egg. Okay, so non-embryonated egg is also ruled out. Okay, so the correct answer is option D, embryonated egg. Okay, so how you can cultivate virus? Like I told earlier, it is somewhat difficult to cultivate virus when compared to the bacteria and fungi. Okay, so there are three methods for this cultivation of viruses. One is animal inoculation. Okay, you can inject the virus into mice or guinea pigs or rabbits or ferrets. Okay, and then see how it is responding, how the animal is responding. Okay, or you can like inoculate into embryonated eggs. Okay, so this embryonated eggs itself, there is a classification, like there are so many layers that are C for this embryonated eggs. Like you can inoculate into the chorioallantoic membrane, or you can inoculate into the allantoic cavity, or you can inoculate into the amniotic sac, or you can inoculate into the yolk sac. Okay, so this was first done by Goodpasture and Burnett. And yes, these are the various types. Okay, so for allantoic cavity, such inoculation is mainly done for influenza and the paramyxovirus. For amniotic sac, it is the influenza virus. And for yolk sac, it is the chlamydia and the rickettsia, for cultivation of chlamydia and rickettsia. Okay. Then there is another third method that is called as the tissue culture also. Okay. In the cell lines, you can do tissue culture for these viruses also. Okay. So yes, embryonated egg is the correct answer. And yes, this is the various membrane, the chorioallantoic membrane. You can get inoculated into this or into the amniotic cavity or into the allantoic cavity or into the yolk sac. Okay, so these are the four parts into which you can inoculate the viruses. Okay, hen's egg or duck's egg can be used. Okay, duck's egg are mainly used for rabies virus because it has a longer incubation period. Okay. Now, next, a virology laboratory is assigned to handle clinical samples from a patient suspected for Ebola virus disease. Which biosafety level facility is required for handling Ebola virus samples? Okay. A virology laboratories can be differentiated based upon the organisms it handles. Okay. If there are like high risk organisms, like some of the viruses, like the Ebola virus, smallpox virus, or the COVID virus are present, then that particular lab should take some precautions. Okay, so such precautions are called as this biosafety level precautions. Okay, so this pathogen protection level. Okay, so this biosafety level, it mainly indicates the pathogen protection level. Okay, not all laboratories can handle all types of viruses or all types of bacteria or all type of fungi. Okay, there are particular restrictions for that. Okay, if you are dealing with some highly contaminant, okay, very highly contaminant viruses, then that lab should take like utmost precautions. Okay, so these are mostly this biosafety level precautions are a set of biocontainment precautions. Okay, they'll check, these are like proposed by the CDC, and they'll check whether each lab is following this particular levels of set of instructions. Okay, so yes, based on that, the biosafety level precautions, there are of four types. Okay, so BSL-1, it handles with the low risk microbes, and towards the top, that is the BSL-4, it deals with the high risk microbes. Okay, so let's see what those microbes are. For BSL-1, they deal with usually the microbes that are not known to cause disease in immunocompetitive human beings. Okay, for a healthy human being, these microbes will not cause any disease. Okay, so such type of organisms are included under this BSL-1. Okay, mainly like skin bacteria, staphylococcus, like that, and yeast and all. They are usually dealt with in the BSL-1 level itself. Okay, BSL-2 deals with microbes that pose moderate potential hazard to personal and the environment, like the herpes simplex virus or the common cold virus and the salmonella virus and all. Yes, the ones that can cause diseases. Okay, they are dealt with in the BSL-2 level. Okay, now coming to BSL-3 level, it deals with indigenous or exotic microbes. Okay, that can cause serious or potentially lethal disease just via inhalation itself. Okay, typical examples are the Mycobacterium tuberculosis and the COVID virus. Okay, and the influenza virus and all, they are all they all belongs to this BSL-3 level. Okay, and the topmost level, you have the exotic microbes. Okay, they are like they possess like a very high risk of aerosol transmitted laboratory infections and can cause life threatening diseases. Okay, no vaccines, no treatments available for such diseases. Okay, so it mainly includes Ebola virus and the smallpox virus. Okay, they are the ones that usually belong under this BSL-4 category. Okay, so BSL-1, the harmless microbes, BSL-4, the most harmful microbes. Okay, just remember like that. And Ebola comes under the BSL-4 category. All right. Now, next question. Which of the following statement is or are correct regarding hepatitis B surface antigen? Okay. This hepatitis B surface antigen, is it positive in simple carrier, or is it positive in super carriers, or is it positive for those individuals following vaccination? Okay, so what is true? For that, let's have a look at the hepatitis viruses. Okay, there are like 6 types of hepatitis viruses, which include A, B, C, D, E, and G. Okay, so A, C, D, E, and G are all RNA viruses. Okay. Whereas this B alone is DNA virus. Okay. The hepatitis B is the one which is known to cause all the serious diseases in human beings. And this hepatitis A and E, it usually gets transmitted through the fecal-oral route, whereas B, it usually gets transmitted through the parental, the sexual or the perinatal. Okay. And there was like a recent question in the NEET MDS examination, like which of the following hepatitis or infection will cause like severe morbidity rate or the mortality rate for a pregnant woman. Okay, so it is hepatitis E. Okay, very severe manifestations in pregnant women. All right. Yes. Now, there are something called as carriers that you will see in this hepatitis infections. So, what are carriers? Carriers are the persons who has the pathogenic microorganism but will not cause any symptoms. Okay, will not show any symptoms or signs. Okay, so they are called as the carriers. They have the microorganism inside them, but it will not cause any symptoms. Okay, so there are different types of carriers like healthy carrier, convalescent carrier, temporary carrier, chronic carrier, contact carrier, paradoxical carrier, and super carrier. Okay, healthy carrier means they have the pathogen inside them, but they have never suffered from the any manifestation of the disease. Okay, so they are called as the healthy carrier. Convalescent means these persons had already suffered the disease and they had recovered from the disease. Okay, after treatment, they had recovered from the disease, but still they continue to harbor this virus inside them. Okay, so they are called as the convalescent carriers. Okay, then we have temporary carriers, which last for like less than 6 months. Okay, like the incubation period of this hepatitis B infection is usually for 1 to 6 months. So there are temporary carriers, and chronic carriers are also there, which last for like lots of years. Okay, they can be in their carrier period for like several years. Okay, then the contact carrier that acquires the pathogen from a patient. Paradoxical carrier, okay, acquires the particular virus from another carrier. Okay, then we have the super carriers. Of super carriers are highly infectious. All right. Yes. So the antigenicity of this hepatitis B is usually manifested with the help of hepatitis B surface antigen or the hepatitis B core antigen and the hepatitis B E antigen also. Okay, so this hepatitis B S antigen or the surface antigen is the first marker to appear in the blood after infection. Okay, they are the first marker to appear in blood and it appears even before the onset of the clinical illness. Okay, the symptoms and the signs have not even manifested. Okay, before that itself, you check the blood of the patient, there will be HBs antigen present in it. Okay, and it remains in circulation throughout the icteric and the symptomatic course. And its antibody, that is the anti-HBs, is considered as the protective antibody. Okay, then HBC antigen, it is not demonstrable in circulation and its antibody. Okay, but its antibody, that is the anti-HBC, it appears after the appearance of the HBS antigen and it is the earliest antibody marker to be seen in the blood. Okay, so the first antigen marker is the HBS antigen and whereas the first antibody marker is the anti-HBC. Okay, please do not get confused. Then HBE antigen, it also appears along with that of the HBS antigen or maybe soon afterwards. The circulating HBE antigen, it is an indicator for active intrahepatic viral infection. Okay, it usually shows that this patient is highly infectious in nature. All right, so that's about the HBE antigen. Okay, so in simple carriers, there will be like a HBS antigen that is present in both simple carriers and in super carriers also. In simple carriers, it will be comparatively low, but it will be still present. In super carriers, it will be present in very high amounts. Okay. And for those persons following vaccination, only anti-HBs will be present. Okay, anti-HBs, it is the protective antibody that will only be present for the persons after vaccination. Okay, so the question was, this HBs antigen is present in which all persons? So it will be present in simple carriers and super carriers and not in persons following vaccination. All right. Yes. Next question. A 45-year-old male patient presents with fever, dry cough, and loss of taste for past 3 days. The physician suspects COVID-19 infection. Okay, which of the following is the gold standard test for the diagnosis of COVID-19? Is it detection of SARS-CoV-2 antibodies or rapid antigen detection test or RT-PCR or none of them? Okay. So after the COVID period, there were like lots of questions related to COVID-19 has been asked in most of the competitive examinations. Even for the NEET MDS 2024 examination also, there was a question on COVID-19. So yes, you can expect questions of related to COVID-19. So which among the following is a gold standard test for diagnosis of COVID-19? It is RT-PCR. Okay. So this is a typical structure of the COVID-19 virus, that is the SARS-CoV-2 virus. Okay, the severe acute respiratory syndrome coronavirus 2. Okay, it will have like extensions, okay, which are called as the peplomers or the spikes will be present. Okay, so that's why it's called as a coronavirus. Okay, just like spikes of the sun. Okay. Then the diagnosis of COVID-19 virus is done with the help of antibodies, or the rapid antigen detection test or the reverse transcriptase polymerase chain reaction. Okay, so let's compare each test one by one. Okay, so for this antibody test, usually we check for the IgM and IgG antibodies, and these antibodies, they appear only after 1 to 3 weeks of infection. Okay, after infection, it will take nearly 1 to 3 weeks for these antibodies to appear. Okay, so it is not a useful test for early diagnosis. Okay, and it usually indicates past exposure. Okay, that is, this person had been already infected with COVID-19. Okay, indicates past exposure, not for detecting active infection. Okay, so the antibody test is not a gold standard test for detection of COVID-19 antibodies, COVID-19 virus. The next is the rapid antigen detection kit, which detects the viral antigens. It is mainly indicated for screening purposes. Okay, because the uh, confirmation, there are like negative results also. Okay, so very less effective in case of like early infections. Okay, so this rapid antigen detection test is also not the gold standard. Okay, then at the last we have the RT-PCR, which is the reverse transcriptase PCR, which detects the viral RNA. Okay, even in very small amounts of this virus is present in our human body, it can detect it. Okay, so it has a very high sensitivity and very high specificity. And even in the early asymptomatic phase or early symptomatic phase itself, we can detect the viral RNA in the human's body with the help of this RT-PCR test. Okay, so this RT-PCR, it is the gold standard test for diagnosing COVID-19 infection. All right. Yes. Now, next question. All of the following are true statements regarding mucormycosis except. Okay. So you should choose the statement which is false. Okay. So all of the following are true statements except. Okay. This word is used particularly to confuse you. So please read the question again and carefully and then only answer. All right. So it has broad accepted hyphae with wide angle branching. high dose systemic steroids and hypervitaminosis A are recognized risk factors. Rhizopus arisus is the most isolated species, and voriconazole is the drug of choice for the treatment. Okay. Yes. So, which are all the false statements or the incorrect statements? Okay. So, let's have a look at the in detail about this mucormycosis. Mucormycosis, it is also called as phycomycosis or zygomycosis. Okay. It is an opportunistic fungal infection that is caused by Absidia or mucor or rhizomucor and rhizopus. Okay. These are the species which can cause this mucormycosis. Okay. This is considered as a fulminant fungal infection. Okay. It spreads rapidly and it is very fatal. Okay. The patient can die within days. Okay. So that's why this mucormycosis is considered as a fulminant fungal infection. Okay. So what are the risk factors for this mucormycosis? Uncontrolled diabetes. Okay. Patients with uncontrolled diabetes and ketoacidosis, they are at increased risk for this mucormycosis infection, and the patients under deferoxamine therapy. Okay. Iron supplement therapy. Okay. And immunocompromised patients like the AIDS patient, bone marrow transplant patients, and the ones that are receiving systemic corticosteroid therapy. Okay, all these patients are at increased risk for mucor infections. Okay, so if mainly it can affect the like the rhinocerebral form, that is the most common form of the mucormycosis. And if you are taking a sample from this mucor and checking it under the microscope, you will be able to see such broad ribbon-like aseptate hyphae. Okay, with wide angle branching. Okay, so these broad means usually the hyphae will only be this thick. Okay, very small, slender. Okay, if you look at the candida hyphae and all under the microscope, it will be very small like this, very small, thin and slender. But look at the mucor hyphae, it is very thick and ribbon-like. Okay, and next is, it is aseptate. Okay, what do you mean by aseptate and septate? Okay, septate hyphae will usually show something like this. Okay, lines like this. Okay, just like the lines that we have in the fingers, like that, lines like this will be present. So fungi like this are called as the septate hyphae. Now, aseptate hyphae means no lines will be present. Okay, look at that here. No lines are seen. Okay, so these are aseptate hyphae. And another way to identify this mucor hyphae is its 90-degree branching. Okay, look at this. This is forming a 90-degree angle here, right? Yes, this is the 90-degree branching. This 90-degree branching is usually shown by this mucor hyphae only. Okay, all the other species, they will usually seen like acute branching like this. Acute angle branching only will be seen. Okay. Okay, acute angle branching will only be seen. Okay, so this type of 90-degree branching is usually seen by mucor only. Okay. Now, Rhizopus arisus. Okay, that's the most common species that is isolated among the mucor species. And this species is usually seen in the rhino orbitocerebral form also. Okay, so this is the most commonly isolated species. Okay, now how you can treat this mucormycosis? Like systemic administration of amphotericin B. Okay, that too high doses are needed for limiting this disease. Okay, so that is the drug of choice for mucormycosis. High doses of amphotericin B. Okay, so let's have a look at the statements. Broad aseptate hyphae with wide angle branching or 90-degree branching. Yes, that's a true. High dose systemic steroids and hypervitaminosis are recognized risk factors. The first part of the question, that is the high dose systemic steroids, that's a true statement. But hypervitaminosis A, no. Okay, hypervitaminosis A is not a recognized risk factor for mucor infection. Okay, only high dose systemic steroids are a risk factor, and along with that, uncontrolled diabetes, ketoacidosis, and like patients under the iron supplement therapy, like defruxamine therapy, they are all under increased risk. Okay, not hypervitaminosis A. Okay. Then next, Rhizopus arices is the most isolated species. Yes, that's also right. Voriconazole is the drug of choice for treatment. No, it is amphotericin. Okay, so 2 and 4 are false statements. Okay, yes. Yes, doctor. So that's all for today. If you have any doubts, you can ask now. Yes. If you are if you want to read the textbook and they go through the questions once again, you can go through them once again. And if you are again feeling doubtful regarding any particular topic or any particular question, you can comment below this video or you can directly DM me. All right. Yes. So thank you so much for attending today's session. Thank you, and we'll see you for another session. Yes. Good night and goodbye.